we have been receiving patients, generally hospitals around the western region of Kenya that manage cancer patients have been receiving patients at very late stages of diagnosis. And when patients present very late, like in stage 3 and 4, the outcomes are not very good. And this is what inspired us to go out there and educate the community on cancer, conduct screening activities in a bid to create awareness, and by so doing also have patients come and present early enough in hospital for treatment. My name is Dr. David Muyode. I work for the International Cancer Institute. We are based in Eldoret and have an outreach that's countrywide. We've been to several countries outside Kenya, and we are involved in community outreach, education, and training. Basically, we are a non-governmental organization that has been doing all this in partnership with the various ministries of health in our counties and countries. I would say a lack of awareness amongst the community of the need for them to undergo screening, particularly with cancers like cervical cancer. Not many people know that you need to do it on a regular basis, breast cancer. And so partly that has been one of the biggest reasons. And then, of course, cultural issues. There is a belief that what you don't know wouldn't kill you. So why should I go screening and then get exposed, get to know that I have a particular disease which will haunt me for the rest of my life? So I would rather stay without knowing. So that's been part of what we are doing by educating communities on the importance of screening so that they can take that opportunity and be screened at their local hospitals.
I'm Kennedy Olweny, and I work with the International Cancer Institute. We have been working in the outreach, community outreach services, just to make sure we reach out to a number of patients and also participants in regards to research. And now I coordinate clinical research and link it with the community outreach. So for us to engage the community directly, we need to go through a process of community entry. And with the community entry, we are identifying the gatekeepers, and that cuts across the religious leaders, the political leaders, and also those who are prominent in the community that can be part of community decision making. So they are important in terms of getting into the community so that we get a proper community entry process through these gatekeepers. So in regards to health, I know this is very sensitive, and looking at also the component of data protection, we cannot just go direct to the community without involving various stakeholders. So that is very important for us.
Our main partner has been the Ministry of Health, both national and county government ministries of health. And we work with the county governments in ensuring that we've reached the communities with these activities of educating the community and also providing the screening for free. And of course, we have other partners, other non-governmental organizations of a like mind that we have worked with over the years.
There is a lot of things before we move to the community. We need to do mapping first, just to understand the terrain, to understand the cultural aspects, and also the beliefs. So once you have this, it makes you to have some information just before you go to the community, so that when you go there, you are not going to demystify all the activities in the community. Remember, we want to integrate. In health, for you to get this information, we want to integrate science and what is already in the community. So when you are going to the community, you need to understand first what is their culture and beliefs and so on. So when we move now to the community, let me just say in a day, what are we going to do first? Which service are we going to give to the community? How is it influencing their culture? What is their perception about what we are going to do? And if we're moving to the community, we are not just going to diagnose or screen. In ICI, we want to complete the loop by going to screen, and we ask ourselves, if we go to screen, what if we get a lesion? For example, breast lesion. Are we in a position to take a biopsy? Are we in a position to run that biopsy and get a histology results? And are we in a position to navigate this patient to where they will get care? So it is moving in with an information of how do we complete the look for care for these patients.
What helps us determine where to go is the fact that we are drawn to areas where we see a bigger burden. For one, we go to where is nearer to us. Like for us here in Eldoret, we've worked mostly in the western region of Kenya, but also we worked in the other regions of Kenya, like Marsabit, the coastal region, central Kenya, and the area of Nyanza. And so we tend to go there and partner with the Ministry of Health to be able to bring about awareness, start screening people, and also train the local healthcare providers to continue with the same.
There's a lot of myths cutting across different cultural beliefs, and they're not bad because it is what they have in terms of information. So it is us to debunk this and put the correct information through proper advocacy. And if you want to implement advocacy, you don't go and rubbish everything. For example, if a community says they treat cancer with the herbal medication, as we say it's okay, we recognize that herbal medication is within that community. You will see some of the patients visiting health centers, but still they'll have those herbal medication with them. So it is how to educate them on how to reduce and give them the benefit on what we want to give. So other community also says, if you are diagnosed with cancer, that is a death sentence, and a doctor should not even inject you with a syringe because you are going to spread cancer everywhere. So how do we give proper information in terms of giving the right information to this population through proper channels of advocacy? For example, we got a patient in the community with a lump on the breast, and for them, they already diagnosed this as a cancer. However, we did an examination, took biopsy, and we just got this. It was a benign lump in the breast. So what did we do? We did just lumpectomy at the site in the community and closed up the wound. When we did the test on this sample, we got this was just a benign tissue. And the patient, we were to go back and say this was just a benign tissue, it was not cancer, and it is done. So that's how we demystify this, yes. Looking at various counties in the country, I've seen they are trying to have a community voice in terms of health-seeking behavior and even involving community level in terms of decision-making in healthcare. So I've even seen some of the counties doing digital programs so that we have, first of all, we have proper data coming from the community, because we could only wait in the hospital to get the true picture of that community. But if we have community health promoters taking all this information and sending it in terms of digital in digital platforms, then we get real-time data and it makes us to have a proper decision in terms of how healthy a community is. So with this, I think we'll have better decision on what a community needs in terms of disease burden, and therefore it will be prompt in terms of reducing a defined disease burden as per the community. It is still bottom-up approach. Most of the doctors are found in towns and away from the community. So we have normally said patient comes to the hospital late with diseases like cancer when nothing can be done at that time. But it is not late. It is about poor navigation and ability to get the specialist in time, bearing in mind health-seeking behavior. So if we can get doctors in within the community just to raise an alarm as early as possible when they see something cropping up, then we are going to arrest some of the early diseases at earliest stage before they progress to a disease which cannot be captured at that time. So it's about bottoms-up approach, having doctors within the community.
Thank you very much for this opportunity, and I would like to encourage other partners to continue with the same, because the need is great out there. Thank you very much.